Entonces, los pacientes...
Overall, the patients in this hospital are very poor.
Y no solamente de Lima.
They do not only come from Lima, but from different parts of Peru, because we're the reference center for the Ministry of Health. It is very costly for the families to come here because of the fact that the areas are very far away.
Por lo que las zonas son muy alejadas.
It's true that the twinning program has been very beneficial in reaching, for example, countries and areas, cities that would not necessarily be able to improve treatment by themselves because of the lack of economic resources and the lack of knowing how as well.
It was very extraordinary to come and find that, people would have to travel for days to come to the hospital. If they were in the Amazon, first they'd have to travel by boat to get to buses. By distance doesn't seem that far in the United States because of geography here in Peru and bus schedules. It can be a week before they can get here from where they're living because the bus only runs once a week. If they miss the bus run, it's another week before they can get here.
Tanto nuestros amigos de Co-Children como nosotros, ambos hemos ido creciendo. Un crecimiento que se nota.
Our friends from Cook's Children's, like us, we have both been growing. It's a noticeable growth in the training and the management of the patients, to have the multidisciplinary team. Not only the hematologists, but we've also trained other professionals in physical therapy, social workers, psychologists, and that has made it possible for the hospital to grow, allowing a better quality of care to the patients.
Permitiendo mejor calidad de atención a los pacientes.
Probably the most amazing thing that I learned is that you can take something like comprehensive care and have a wonderful idea and have done it for 20 years, and you can want to bring it to a country like Peru, but you better be prepared to adapt that to their culture and let them figure out how it's going to work for them so that they'll be able to sustain that concept, because they may like the concept and they may agree with the concept, but if they can't do the concept, it's not going to help anybody.
I've been working with patients with hemophilia for well over 15, probably 17 years. And when I first had the opportunity to come here, I thought about what I would need. I prepared lots of talks, and I had all this equipment, was so excited. I had this great plan in my head about what I was going to do. And I came here, and they didn't need what I had planned. They needed to learn how to use an ACE bandage.
Así, levántate. No, derecha. Levántate aquí. Hold it. And then despacio. Okay.
So virtually every day I was here during that trip, I taught patients how to use elastic bandages and wrap them appropriately. I taught families how to use ACE bandages appropriately. I taught nurses and local physical therapists the correct way to wrap a bleeding joint to provide support without causing any harm.
We have a patient, a little boy named Jimmy, who I know without the help that we've come with and the kind of education, he would not be the way we've seen him on this visit. He looks like a very normal, healthy little boy, and I truly believe in my heart that's happened because of our presence here through the Twinning Program.
Cuando tuvo 8 meses de edad y tuvo una hemorragia intracraniana, no supe ese.
When he was 8 months old, he had an intracranial hemorrhage and I didn't know. After that, he began vomiting. He had a fever and was hospitalized. From there, we were sent to get some lab work and he was diagnosed with hemophilia, type B, severe.
Cuando es hematoma, le pongo
Well, when it's a hematoma, I place an ice compression on him. I give him his tranexamic acid, and I immediately take him to the hospital. From there, the doctor gives him factor 9, which is the one that my son lacks. The truth is that I do everything by myself because my husband works and I only stay with my son. Is it okay if I stand up?
There's a young man in the hospital. He's a teenager now. When we first saw him, he was 15. And he was an amputee because of a pseudotumor. And each time we come back, I've noticed they keep removing more and more of his limbs, with now the possibility of losing his other leg and an arm. And I just wonder, when does that all stop? And this young man has such spirit about him, and every time we see him, he's smiling, and we're all ready to cry.
During my first trip, we were in the clinic seeing patients, and a young man came in with a severe muscle bleed. He was in agony. I looked at Dr. Nancy and said, "Do you have any morphine?" And she said, "Well, the morphine's in the emergency room and we need to give him factor first." And so I looked around and I said, "Okay, great, where can I go get some ice?" And she looked at me and said, "We don't have any ice here." And I thought she just meant in the blood bank. I said, "Well, where can I go get ice?" And she said, "You don't understand. We don't have any ice in this entire hospital." I was dumbstruck.
Status of healthcare for people with hemophilia in Peru, I think, has improved a lot over the last 5 years. From the first time we came, there was no factor, no really established treatment center, no good care, no follow-up. It was fairly poor. I think over the last 5 years, once they established one hemophilia treatment center, and I think with the great support of Dr. Loaiza pushing this program, pushing the government to recognize this as a disease.
The first time I saw a young boy, a young man, and it seemed like the only option left was to remove an arm or a leg, I wasn't sure where to put that. I didn't have any reference for that kind of severity. And I would leave each patient feeling more sad and more sad, wondering how are we ever going to change any of this. And each time we come back, what I find is sometimes we don't change the immediate situation, but I'm seeing a change overall and things are getting better.
The twinning program, definitely one of the main goals is sustainability. It's building up the different hemophilia treatment centers around the world. It's ensuring that the medical professionals receive the training they need with the goal of being able to provide long-term sustainable care.
Un hermanamiento, si somos hermanos, no se termina nunca. Un hermanamiento dura.
A twinning, yes, we are brothers. It never ends. A brotherhood lasts a lifetime. We believe that the twinning will continue. Maybe the agreement might end this year, but the bonds that have been united, those will be for a lifetime. And we will continue to follow this model and take it to the whole country, and in that way make it so that there's ideal treatment of hemophilia for all.
Well, as I'm trying to look in the future for Peru, I hope our team, has made a contribution, and I feel like we have, just to let them know that there's somebody out there for them.